Shipments of Pfizer's newly approved antiviral drug will soon be arriving in provinces across the country. But the shipments won't be large, and that's going to create challenges around who should get the drug and how they're going to get it. And all this is happening against the backdrop that that expectation that Omicron cases are going to peak this month. So joining us this morning is infectious disease specialist Dr. Isaac Bogoch. Lots of questions around this. More than 10,000 people right now are hospitalized with COVID-19 right across the country. We know that the healthcare sector is overwhelmed. How will these initial shipments potentially play in slowing those rates down?
Yeah, I think we have to be very realistic about this. The initial shipments might not have the most significant impact on this wave. They certainly will help individuals, and they certainly will be helpful, but I don't know if they're going to change the course of this current wave, excuse me, that we're in. Remember, these drugs are very helpful, at least we think they're helpful. That's what the data points toward in keeping people at greatest risk of hospitalization out of hospital. So those with risk factors for severe infections had about an 85 to 89% reduction in risk of being hospitalized and succumbing to COVID-19 if they started this medication early enough.
So a couple questions around the medication. First of all, we understand that's to be, you need a prescription to get it. So how does that come? Do you see your family doctor? How do you get the prescription?
You know, we really haven't heard much on how this is going to be rolled out. And I think it would be very helpful to have some clarity as to, where people can access this medication, how people can access this medication. Not only do you need a prescription, you also need a test, right? You have to have a positive rapid test or a positive PCR test to confirm that someone's COVID-19 positive. And you have to start the medication very early on after symptom onset, within 5 days. But of course, the sooner the better. So it's one thing to have access to this medication. It's another thing to roll this out in a meaningful manner that will help individuals at greatest risk for severe outcomes of COVID-19. And there certainly are logistical challenges in implementing this successfully.
And is there any outline for doctors? Are there people more at risk that should have access to it more than others? Because we do know in the beginning, supply is going to be limited.
Absolutely. Supply will be limited in the beginning, and you really want to have carefully chosen patients that would most benefit from this medication. So, Health Canada and the Public Health Agency of Canada had some guidance, but in general, it would be people on the older end of the spectrum. It would also include people with certain underlying medical conditions that would put them at greater risk for a severe outcome. The other thing that I thought was very helpful that they mentioned was, they included rural areas and Indigenous communities. And these are settings that might not have the same degree of hospital capacity. And I think these drugs would do a lot of good in preventing hospitalizations, especially in those areas as well. And I thought that was a very good idea, too.
All right. It's called Paxlovid, like COVID. Am I saying that right?
Paxlovid, yeah. And it's actually two medications. There's two medications under the umbrella of Paxlovid. One of them is very hard to pronounce. Nirmatrelvir is one of the drugs, and the other drug is called ritonavir.
That's why I left those for you. Those are going to continue. Those are going to continue, Dr. Bogoch, in the coming months. But we do know that COVID-19 is at some point expected to become an endemic. I mean, this is your field of study. What does this drug mean in the longer term?
Yeah, I think that's a great point, Anne-Marie, right? Because at the end of the day, while this drug will help certain individuals soon after it lands in Canada, I think the real benefit of a drug like this is longer term, right? COVID's not going anywhere. It's going to be around for a long, long time. We obviously hope it doesn't disrupt our society as significantly as it has in past waves. But, in the future, you can imagine if someone has signs or symptoms of COVID, they can go to a pharmacy or a family physician or a point of contact for healthcare, get a quick rapid test or a quick PCR test, have a rapid turnaround time, and start this medication right away and prevent someone from getting sick enough to land themselves in hospital. It's great for the individual. It's great for the healthcare system. It, at a population level, certainly would alleviate more significant disruptions if we have, a lot of cases of COVID at that time. Over the long run, I think this would be a very, very helpful tool in the toolkit for COVID-19. Again, it's not a game changer. It just adds incremental benefit to individuals, to healthcare systems, and to communities.
All right, Dr. Bogoch, still some more questions for you, but we'll leave those for next week because we will probably be talking to you next week. Have a great weekend.
Be well, you too.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.